Asthma sufferers do not have to worry anymore because they are not the only ones who are dealing with this disease on a daily basis. According to the American Lung Association, millions of Americans have asthma. Professor of Medicine and Pediatrics at Penn State Hershey, Dr. Timothy Craig, believes that asthma is not just one disease, but there is also a possibility that other diseases are linked to it.
Asthma is probably really not a true disease like we think of. And probably really what it is a manifestation of multiple diseases. All of them have in common that people have wheezing and shortness of breath and constriction of the airway.
There are many factors that can trigger people's asthma, but environmental factors and exercise are the most seen in asthmatics. Many environmental factors include pets, mold, and dust, according to the Impact of Environmental Controls on Childhood Asthma Journal. Another common type of asthma that people have is called sports-induced. This is a type of asthma that can be activated by exercise or any type of physical activity that increases your breathing. Controlling this disease can be difficult but manageable. There are different types of medicines that you can take to reduce asthma attacks. The most used are bronchodilators, also known as inhalers. They are devices that can be used prior to or in the middle of an attack. Dr. Timothy Craig says that the best medication to use for asthma is the inhaled corticosteroids.
Probably the best medication out there for asthma is inhaled corticosteroids, and they work very, very well. Actually, they decrease asthma attack, daytime symptoms, nighttime symptoms, the need for ER visits and hospital visits, and actually even death.
There are non-medicinal ways of controlling your asthma if you do not want to be on any form of medication. Breathing exercises can train your lungs in order to handle an attack. Other ways to control are wearing a face mask during exercise. Wearing a face mask humidifies the air you breathe in, which helps control asthma. Playing short bursts of sports like basketball or tennis can also help build up your breathing, according to the journal Diagnosis and Treatment of Exercise-Induced Bronchospasm, a review. Penn State student Leah Bowers says that she has trained her lungs in just one short year because she did not want to carry around her medications and inhaler all the time in case she had an attack.
I need to get by myself to stop having the panic attack, which increases my asthma. And then you need to slow down your breathing consciously, take as deep breaths as possible. And most of the time, whenever I finish, I have to have someone hug me to breathe with their rhythm.
Asthma is a controllable disease that millions of people have. It can be developed or outgrown at any point of your life. Anyone who thinks that they possibly have asthma should go to their doctor to have it checked out. I'm Ashley Slack reporting for Comm Radio.